everyone, our presentation is on Black Man in a White Coat, A Doctor's Reflections on Race in Medicine by Damon Tweedy. Presented by Jael W, Bria S, Kyle Kessler, and Brandon Watts.
Black Man in a White Coat by Dr. Damon Tweedy is a memoir that showcases Dr. Damon Tweedy's experiences within the medical field, the compilation of how personal experiences and corresponding thoughts penetrate much deeper than the shallow pool of black versus white. Tweedy separates his memoir into three different parts. The first part, entitled Disparities, gives an introduction on who he is and his accounts during his early life in medicine as a medical student. The ensuing portion, Barriers, discuss the racial encounters he faced while serving as an intern and resident. The last section, Perseverance, is a combination of the new experiences as a psychiatric physician and the recollection and application of prior personal and medical occurrences.
Tweedy thought race was a topic he could avoid until the first day of class when Tweedy's professor mistook him for a maintenance worker who was called to fix the lights. From that moment forward, Tweedy dedicated the remainder of his semester, and essentially medical school, to proving that he was capable of excelling as a physician. Within Tweedy's first year of medical school, he meets Leslie, a 19-year-old pregnant girl with blood flowing from her lower abdomen. Tweedy, a novice to the hospital scene, realized that he made a failed attempt at diagnosing Leslie when the visibly pregnant woman continued to deny that she was even pregnant and could not provide information to help him diagnose her. Tweedy's supervisor, Dr. Garner, reviewed a few tests and noticed Leslie was experiencing a late-term miscarriage that may have been caused by drug abuse. When he spoke with Leslie, she continued to deny any substance abuse. Dr. Garner then erupted and asked, "When was the last time you smoked crack?" Although Dr. Garner's reaction did result in a quick diagnosis for Leslie, who unfortunately lost her baby due to substance abuse, Tweedy disagreed with the disdain Dr. Garner showed for Leslie's crack addiction. Dr. Garner had very little empathy for Leslie. He even expressed how glad he was the baby died because of his disgust towards crack babies. Throughout this experience, Tweedy never speaks up. Shortly after, Dr. Tweedy learns that Leslie was much more than a 19-year-old crack abuser. He discovered that she has experienced sexual abuse since she was 8 years old and has made various failed attempts to change her life. In this section, Tweedy learns of the importance of the patient's backstory and how doctors can carry their biases to the operating table.
In the section Barriers, Tweedy recalls multiple accounts that further show the way that predispositions, specifically in regards to culture, impact the medical encounter, both for the patient as well as the provider. Dr. Tweedy meets a patient named Chester. Chester came into the emergency room showing signs of an infection with his family, who were dressed in Confederate flags surrounding him. Chester made one request when he arrived. He didn't want any black doctors treating him, but instead he used the N-word. Unfortunately for Chester, he was at a hospital with a skilled, predominantly black staff. Luckily, Chester eventually sees past his prejudice once his health began to show signs of improvement. This comment affected Tweedy greatly because this was one of the first encounters where he experienced blatant racism towards him. Tweedy gained Chester's trust and provided that he was much more than a black doctor who won his spot as a result of affirmative action. Similar to the commitment trust theory of communication, this increased trust resulted in increased communication. By providing quality care and respect to Chester, Tweedy eventually gains the trust from Chester and his family as well.
The final part of the book is still coming from Tweedy's experience, but this time as a practicing physician. At this point, Dr. Tweedy is still expressing his theory on race and medicine based on his own personal narrative. Now, however, he is able to tie all of the accounts from the past and the present to create concrete ideologies that only a person with his long years of experience could conclude to. He develops the notion that the disparities faced by blacks are in fact partially inflicted due to genetics, but more forcefully by social and economic factors that influence the healthcare system. He believes the problem is represented in three forms: system-based differences that limit black people's access to medical care, the doctor-patient relationship between the two, and the unhealthy lifestyle adopted by blacks in America. These points are all very apparent in the myriad of other healthcare issues and healthcare communication principles that affect the effectiveness of the healthcare system as a whole and not just in an isolated regard to race. Tweedy learned firsthand being black could be bad for your health. For example, African Americans are more likely to suffer from hypertension, heart health issues, and infant death at a higher rate than whites. Tweedy experienced this disparity from both ends of the stethoscope as a patient and a professional. In the long run, Tweedy's compassion and unwavering empathy towards his patients, professors, and colleagues served as a model for how professional caregivers and their constituents could result in an equitable care system.
Here are the discussion questions we would like you to answer.
Thanks for listening!